Hi, beautiful people. How are ya? I hope you're having a great day. We know that people with fibromyalgia and ME/CFS have a sensitivity to temperature. When we're exposed to heat, it might feel like we're burning up, or it feels like we can't cool down. And some of us are bothered by cold weather and feel like it's chilling us to our bone. And then we struggle to get warmed up. Or we might struggle with alternately feeling cold and then hot and be completely out of sync with the environment. This seems to all occur more frequently in women, but if you're male, do you experience this? Let me know in the comments section. It's common for anyone with fibro or ME/CFS to have cold hands and feet. Studies have shown that we have extra sensing nerves along special skin blood vessels called AV shunts. In fibro and ME/CFS, what is believed to cause these symptoms of an inability to regulate body temperature may be from a dysregulation of the autonomic nervous system. In people without these two conditions, when they get cold, the blood flow is redirected to warm up that area. But when dysautonomia issues are involved, the body isn't able to adapt properly. So the feet and hands stay cold. When pain is directly related to being cold and no damage to tissues is occurring, this is normally called thermal allodynia. If your ANA test is positive and your SED rate, erythrocyte sedimentation rate, not sure if I said that right, if it's high, you might have another condition called Raynaud's syndrome alongside your fibromyalgia and ME/CFS. It may be that the problem is severe enough to warrant its own diagnosis. If your hands or feet change color, you may be experiencing this serious condition. Researchers have stated that between 18.2% to 53.3% of patients with fibromyalgia have reported Raynaud's symptoms. So today, let's talk about these confusing symptoms and what Raynaud syndrome or Raynaud's phenomenon is about. Here we go. Raynaud's is when the blood vessels will constrict more than they should, which reduces blood flow to that area. It occurs most commonly in the fingers and toes, but it can affect your lips, nose, earlobes, and knees. Skin color changes can occur. Your skin may become pale, and that's called a white attack. It can occur anywhere on your fingers, usually not the thumb, sometimes just the tips, sometimes just one finger, or the skin can become purple or blue, called a blue attack. You can see on this picture that the tips of the fingers are blue. You may feel a discomforting feeling like pins and needles, aching, numbness, or clumsiness. Usually, pain accompanies those who have secondary Raynaud's, meaning it occurs after another condition like fibromyalgia, ME/CFS, lupus, RA, or Sjogren's syndrome. The blue attack is usually short-term, and occasionally it can occur on the arms or legs. And as I said, rarely on the thumb or the tongue. The symptoms will resolve as soon as cold or stress is removed. It may take about 15 to 20 minutes for normal blood flow to resume, and the skin will blush or become pink. It's extremely important to keep your body warm because in severe cases, deeper tissue injury can occur and lead to loss of the tips of the fingers or toes in some people with secondary vascular diseases. You want to avoid the skin breaking down, which leads to ulceration. But for any of you with Raynaud's, it's important to use strategies to keep the whole body warm and avoid shifting temperatures, cold breezes, and damp, cold conditions. Use mittens and gloves and wear layered clothing if you have this condition. At the same time, it's important not to wear anything that restricts blood flow, like rings or tight socks. You can stop the attack by putting your hands in warm water, not hot, or in a warm place as soon as possible. Moving or massaging the affected areas can help. Adding fish oil or ginkgo supplementation might help, but research doesn't conclude it makes a significant difference. Medications like decongestants that contain pseudoephedrine or phenylephrine should be avoided, and diet pills that contain amphetamines. Some migraine medications that contain ergotamine, I guess that's how you pronounce that, herbs that contain ephedra, and some ADD medications might aggravate it. Always talk to your doctor and make sure that you're following what your doctor recommends. Like most illnesses, stress should be reduced with relaxation techniques. If these measures are not enough, then a calcium channel blocker or other medication is prescribed, and researchers are showing that some topical medications can help, and even Botox. I became aware of this condition many years ago because of my cold fingers and toes. I always checked to make sure that I didn't have discoloration, and I don't, thankfully. And my SED rate has always been normal. So I'm assuming at my age, it's not something I'm going to suddenly acquire. And it's believed that the cold sensitivity in fibromyalgia and ME/CFS have a different etiology or cause than those with Raynaud's phenomenon. It isn't really known what causes Raynaud's phenomenon, and there isn't a cure. So please seek medical advice if you're experiencing any of these symptoms. I hope you learned something. I send you gentle hugs and support. Love you. Is redry. This is or cleanliness. Alternate. Or we might struggle with alternately feeling cold and then hot. Or we might struggle with alternately feeling cold or hot. No. Special skin bloods. You may be experiencing this more serious pain accompanies those who have sedentary Raynaud's, meaning, usually, pain accompanies indication. that contain pseudoephedrine phenol.